My name is Diane Nugent. I'm a hematologist and I take care of children with blood disorders and any immune problems or bone marrow failure. And today I've been asked to talk a little bit about our research program here at CHOC, and in particular how this research helps children in our community and in Orange County. Probably the overarching goal of our research department here is the identification of how genes talk to each other and what are the regulators of those genes. Our genes are very important for determining whether we have normal blood cells, whether our immune system is there to help fight infection, and also to make sure that every aspect of our blood vessels, how they flow, whether they clot, are working for each and every one of us. Sometimes normal children do well until they have an overwhelming infection, if they're in an accident or they have burns, and then our blood system can sometimes cause problems for us. And it's our job as researchers here at CHOC to make sure that all of these systems behave well and we minimize the long-term consequences of children as they come into our hospital here, and that they maintain a full and active life. An example of how a normal child might run into problems would be when a child has a clot that maybe goes to their brain following an infection or an association with perhaps an abnormal heart valve. How do we help that child that has a stroke heal and be well? It's our job in looking at the blood to determine, is there a clot in the brain? How do we dissolve that clot right away so that the brain heals itself and is functioning? In a similar manner, we take care of patients that have excessive bleeding or problems controlling their clotting system. Diseases like hemophilia are very important to us, and even rarer disorders where children can bleed spontaneously. CHOC is the center, our research program is the center here in the United States for children with these rare bleeding disorders, in particular factor 13 deficiency, where children do have bleeding in their brain. It's our center that distributes the normal clotting protein factor 13 to centers across the United States, and we're very proud to be part of that network and to take a lead in that area. Our research is also devoted to looking at how our platelets, little cells that help us clot, work for normal people, for normal children when they're sick, and also if you're born with a deficiency or an abnormal functioning in your platelets. Here, people send us blood, again, from all parts of the United States to look at the proteins and look at the genes and help understand how they work in each and every one of us. Finally, I would say that our focus is to make diagnoses in children with rare diseases that present here in CHOC Hospital. We want to be a resource for everyone, and we want to be sure that everyone has access to the research that's available here at CHOC.